Just was like, this is a maths problem. Okay. Hi guys, welcome back to another video. I'm in a different location today. I decided that I wanted to film in one of our consulting rooms because I just like the space. It's very quiet, very peaceful, and I just thought I can actually focus. Let's just get started. Let's get scrubbed in and talk about implants. Now, if you're like me, when I first started out as a dental nurse, I was so scared for some reason of dental implants and dental surgery. Everything just sounded complicated up until maybe a week ago. Yeah, literally a week ago. Dental implants are a treatment option for people who are wishing to replace missing teeth. It will help improve the appearance. So if they're unhappy with their smile, improve speech and improve their confidence as well as improving their function with their teeth. Let's just start with how the implant procedure works. So implant placement, in some cases, you can remove the unhealthy tooth and place the implant at the same time. The patient can either be under general anesthetic or they might choose to have this done as a local procedure under local anesthetic, which means that they're fully awake and they're just numb, so they don't feel anything. Sometimes people can find this a little bit uncomfortable because you can hear everything. There's a lot of things going on, and sometimes you can feel pressure, tightness, things like that, and people get a little bit uncomfortable. So if this is something anyone is thinking of doing, just make sure that you are comfortable with the procedure. So if you do need to be asleep, be asleep. If the tooth has been missing for some time, the surgeon may suggest bone grafting for you. If this is your case, the surgeon will inform you of the process, and they will most likely use synthetic bone, donated bone, or in some cases can actually use your own bone as well. This will have to be discussed with the surgeon, and every case is different. In more complex cases where there's not enough bone, the surgeon may actually suggest something called a block graft, which is basically where a thick cortical sheet is placed over the site where the bone graft is needed, and it's screwed in and held in place to regenerate bone, and it will usually be there for about 5 months before you can actually have an implant placed. It's case by case. Everything needs to be discussed with the surgeon. That's why we have consultations. Okay, so once we're ready to place an implant, the surgeon will make an incision to raise the flap or to move the gum away from the bone area where we're going to be placing that implant. And then we will start the drilling process. Then you have an implant cassette. And in that implant cassette, you have many different drills that the surgeon will use to create a space to place the implant. Depending on the implant size will depend on the length of the drills that they use. Once the implant is placed, a healing abutment will be placed on top, which is like a small metal stud. And this is there because the gum will actually start to heal, and you don't want the gum healing over the top of the healing abutment. The cap provides a framework for the gums to heal around it, just like how they would with a natural tooth. So then there's stage 2, which is either stage 2 or a talk test. You don't actually have to do stage 2 depending on what happens in stage 1, the initial placement of the implant. And this is where the surgeon will reopen the site from the first procedure and will place the healing abutment, or will need to change the healing abutment. If this is not your case, and you will know this, your surgeon will let you know if you need a stage 2 procedure. But if it's not, then you might need a talk test, which is where the surgeon will test the integrity of the implant with the bone and just make sure that there's enough connection there for the tooth to go on top. And once you've been given the go-ahead, you can basically go back to your dentist, have the impressions made, that will be sent off to a lab for the implant retained crown to be made and then secured onto the implant. You do still need to keep implants clean though. This is not like, okay, I get a second chance at life and I don't have to look after this thing. You do. Everything requires maintenance. Things that can make an implant fail are people who are heavy smokers, people who grind their teeth or clench and don't have appropriate devices to help them prevent this, and people who just have poor oral hygiene and don't look after their implants. These are all reasons why implants would fail. And it is a gutting feeling if this happens, because all that work, all of that time, all of that money just for something to not be able to work. So it is super important that patients are aware that they have to maintain and look after the implants, and they also have to look after their general well-being as well, including their oral hygiene. It took me ages, honestly, don't feel bad. It took me ages to understand. And even now, I still feel like I have to always go back to my notes and look at things just because I want to be correct. And I just feel like my advice would be, if you're not sure, just ask. Just keep asking questions and you'll get it eventually. But hopefully, like, this is going to help, because I remember looking at this thinking, holy hell, what the hell do you mean 4.5, 4.8, 4. Like, I just was like, this is a maths problem. Okay, so let's talk about the different types of Straumann implants. TL, which is tissue level, BL, which is bone level, BLT, which is bone level tapered, BLX, and TLX. Now, anything that looks like it has a neck, like so, this is tissue level. So aesthetically, tissue level is not suitable for anterior teeth, so they're usually used posteriorly, so on the back molars. So usually tissue level will come as a wide neck, so a WN, a regular neck, an RN, or an NNC, which is a narrow neck crossfit. So depending on the space available for the implant, that will determine what size you use. And then we have BL and BLT. So bone level is parallel, and then bone level tapered, you'll see that it has like a tapered bottom to it. These come in RC and NC, which is regular CrossFit and narrow CrossFit. You see where I'm going with this? BLX and TLX. So BLX is anterior and TLX is posterior, and they'll use an NT, RT, and a WT, which is a narrow torque fit, regular torque fit, and a wide torque fit. It's a tongue twister saying all of these. I know you're probably confused. I promise it ain't that deep. Let's have a look here. So I have a bone level tapered implant here, which is a 4.1 size. So it's a 4.1 by 8. So you can see the size here on the front. So I know that the biggest clue I have to match this with the abutment would be right here where it says RC. So I know that my healing abutment needs to have the same RC here. And then you just want to make sure that you have the right size for the right space that's available for placing the implant. I really hope that this has clarified like a few things that I found really difficult to understand when working with implants. And like I said, it's not going to come naturally. It is really confusing. And obviously it's more confusing when you've got to learn multiple implant systems. There are so many out there, and this is just the one that I work with a lot. So it's the one that has the most implant types as well. So once you get your head around it, it's actually pretty simple. And then just always remember to ask the person that you're working with, double check everything, and then just follow your notes. And if you get stuck, just go back to this video, rewatch it until you understand it, write things down. And if you have questions, please ask. I'm more than happy to help and give you advice on my end. And then there are heaps of reps floating about on Instagram too, so just hit them up. What is our role as dental nurses, dental assistants, surgical assistants? What's our role? So it's basically to maintain the equipment, making sure that our surgical cassettes are cleaned properly, they're sterilized, they're well maintained, all the drills are in the correct places. This just makes it easier for procedures. It makes it easier for the surgeon. It makes it easier as well for you to learn too. I do recommend, if you're ever stuck and you're not sure how things are supposed to be cleaned, like you're not sure about sterilization, There is a great Instagram account, Dental Assisting and Beyond, and Rochelle does courses as well where you can learn the sterile field and setup. I definitely recommend checking her out if you're ever confused on any of those things. So it's our responsibility to make sure all this stuff is good to go for the surgeon. And it's just the added bonus when you understand all of the implant systems as well, because then it's easier for you to discuss with the surgeon, to ask some questions. And then it's also easier for you to understand what's going on in the procedure and what sizes you need and things like that. So it is really valuable to have that knowledge. Keep learning. And like I said, if you get stuck, just watch this video back.